Good morning, students. I am Dr. C. Bharath, Associate Professor from Department of Public Health Dentistry, Vinayak Mission Sankaracharya Dental College. Today my topic for today's presentation is concepts of disease. These are my contents. First I will be talking about the introduction to this topic, then the concepts of disease, various concepts, that is epidemiological triad, multifactorial causation, natural history of disease, web of causation, risk factors and risk groups, spectrum of disease and iceberg phenomenon. Coming to introduction, disease is nothing but any kind of impairment which affects the person. So, any kind of impairment, that is, it is usually a impairment or a departure from state of health, any alteration in the human body which is interrupting the performance of vital functions. So, according to this, it is a maladjustment of the human organism to the environment. So, there are many environmental factors which play a role in the causation of a particular disease. It can occur from either social factors or from environmental factors. Apart from this, there are other factors, that is your host environment and your agent factors which are related to the causation of a particular disease. So, it is nothing but a deviation from the normal functioning of a human being. So, coming to the first concept, that is the concept of causation. Concept of causation usually deals with the causation of a particular disease. So, how a disease is affecting a particular person. So, when you see what are the causes of a particular disease, according to Louis Pasteur, there are various factors or various concepts that were put forward. The earliest theories that were put forward, that is the supernatural theory of a disease, theory of spontaneous generation or theory of humus. There were all the previous generations they were put forward. So, this concept is mainly based on the theory of humus or the supernatural causes which are related to the occurrence of a particular disease. So, next comes the germ theory of disease. So, in the germ theory of disease, there is a one-to-one relationship between the causal agent and a particular disease. So, what is this? According to Louis Pasteur, the germ theory of disease is nothing but caused by the agent factors which are related to the occurrence of a particular disease. So, what are these agent factors? Agent factors are nothing but the microorganisms which are affecting a particular person and which causes a particular disease. So, when you see these microbes alone does not cause a particular disease. So, according to this, there are other factors. So, it emphasizes that the microbes alone causes a particular disease. So, disease agent usually affects a man and which causes a particular disease in the human being. So, according to this germ theory, only the microbial agent or the agent factors are responsible for the causation of a particular disease. Next came the epidemiological triad. It was thought that there are other factors which are related to the occurrence of a particular disease. That is, there are other factors like your agent, host and environmental factors which can affect the particular person, which can cause a disease for a particular person. So, they thought that it is not only the agent factors, there are other factors like environment and host factors which can also involve in the occurrence of a particular disease. So, in epidemiological triad, there are three factors, that is your agent, host and environmental factors. So, what are these agent factors? These agent factors are nothing but these are substances, either living or non-living substances, tangible or intangible, the excessive presence or relative lack of which may initiate or perpetuate a particular disease process. So, what are these agent factors? There are different agent factors, that is your biological agents, nutrient agents, physical agents and chemical agents. So, first is biological agents. Biological agents are nothing but the viruses, bacteria, the protozoa, that is your agent factors or other microorganisms which can cause a particular disease. Next comes the nutrient factors, that is your vitamins, minerals, proteins, fats. Any lack of vitamins will cause a particular disease. Lack of minerals will cause disease, like lack of proteins will cause protein energy malnutrition. So, these are the examples for nutrient agents. Next comes the physical agents, that is your heat, exposure to heat, pressure, radiation or sound, and then your chemical agents, that is the external or internal chemical agents which can cause a particular disease. Okay, next we will see about what are the host factors. So, till now we saw about what are the agent factors, now we will see the host factors. So, what is a host? Host is nothing but a human body or a person there. So, host is nothing but a human being. So, what are the different variables which can affect the occurrence of a disease in a human being? It is the age or the gender of a person, the ethnicity, other factors like your genetic factors, biochemical levels, enzymes, immunological factors, and other social and economic factors, that is the socio-economic status, education, occupation of a particular person, where the person is occupied, what kind of education or what kind of education is pursued, what is kind of knowledge that he has, and then other factors, that is your lifestyle factors like your nutrition, physical exercise, the habits and behavioral patterns of a particular person. Next comes the environmental factors. So they thought that apart from this host factors and agent factors, there are other factors, that is your environmental factors. So what are these environmental factors? Environmental factors which can affect a particular person, like the physical environment, that is your air, water, food, housing, etc. The biological factors, that is your viruses, other microbial agents, and psychosocial factors, that is your customs, beliefs, attitudes of a particular person, the morals and the religion of a particular person, which can influence the occurrence of a particular disease in a human being. Okay, till now we saw about what is the different epidemiological triad that are responsible, what are the different factors that were responsible. So in this epidemiological triad, they thought that only 3 factors are responsible, that is your agent, host and environmental factors. So after this, the new concept was put forward, that is known as a multifactorial causation. It was put forward by Pettenkofer of Munich. So in this multifactorial causation, according to this concept, there are multiple factors which are responsible for the occurrence of a disease. It is not only 1 or 2 factors or 3 factors. So there is multiple factors which can occur, which can cause a particular disease in a human being. So what are these multiple factors? Multiple factors can be your smoking status, the lack of physical exercise, lack of poor oral hygiene, which can affect the particular person, which can cause a disease in a human being, like smoking causes lung cancer. So apart from smoking, there are other factors which are responsible for the occurrence of lung cancer, like exposure to occupation, like occupation related diseases, persons who are working in factories, any coal burning factories or any mines. So these people are more exposed to the dust and other particles, so which can expose the person to the occurrence of a particular disease, that is your lung cancer. When you see the coronary heart disease, there are multiple factors which are responsible, like your lack of physical exercise, lack of proper maintenance of proper diet, high intake of carbohydrates or fats, which can affect a person and in turn which can lead to the occurrence of coronary heart disease. So according to this, there are multiple factors, that is your multiple factors which can lead to the occurrence of a disease. So according to this, there are other factors, that is your social, economic, cultural, genetic and psychological factors which are important in the occurrence of a particular disease. Next comes the web of causation. Till now we saw about the multifactorial causation. Now we will see what is the web of causation. Web of causation is nothing but any one particular factor which can trigger the occurrence of a particular disease. So these are known as predisposing factors which can affect a particular disease. So if you remove one particular factor, you can prevent the occurrence of a particular disease. So if you control a particular risk factor, then you can prevent the occurrence of a particular disease. Like for myocardial infarction, you have your smoking, there is a risk factor. Apart from that, there are other factors, there is a hypertension or your obesity, lack of physical exercise. So in this, the aging factors, other factors are also there. So when you try to break the link or when you try to control a particular factor, that is if you ask the patient to stop smoking, then the risk of myocardial infarction gets reduced. If you ask the patient to go for regular exercise, then you can prevent the occurrence of myocardial infarction. Then the abundance of food, the lifestyle factors that can affect the occurrence of a particular disease, like the lifestyle factors, that is the type of food that the patient is consuming, the high amount of fats, carbohydrates, sugar substances. So if you try to reduce that particular foods, then you can reduce the occurrence of myocardial infarction. So web of causation is nothing but all these factors are interlinked together in order to cause a particular disease. So if you try to break a particular risk factor, that is if you try to stop a particular risk factor, then you can break this chain and then prevent the occurrence of myocardial infarction. So this is web of causation. So next comes the natural history of disease. The first one is a pre-pathogenesis phase and the pathogenesis phase. So, what is this pathogenesis and pre-pathogenesis phase? Pre-pathogenesis means, it means before the occurrence of a particular disease. Pathogenesis means after the occurrence of a particular disease. So, what is this pre-pathogenesis phase? In the pre-pathogenesis phase, you have three factors, that is your agent, host and environmental factors, which can be prevented by means of primary prevention. That is, before the occurrence of a disease, you are trying to prevent it, like that is known as your primary level of prevention. Under that, you have your health promotion and specific protection. The next comes your pathogenesis phase. Pathogenesis phase is nothing but after the occurrence of a particular disease. So, what comes after the occurrence of a particular disease? After a disease has occurred in a human host or a human being, you have your host reaction, and then you have signs and symptoms which are related to the particular disease, and then you have the chronic disability, then you have defective state, then you have a, which ultimately leads to a chronic state. If this chronic state is prolonged for a long period of time, it causes death. So, how to prevent it? It is meant by means of secondary prevention and tertiary prevention. So, what is this secondary prevention? Secondary prevention, under that you have your early diagnosis and prompt treatment. So, what is this early diagnosis? If you diagnose a particular disease early, you can try to prevent the progression of a disease. So, that is secondary prevention. What is tertiary prevention? Tertiary prevention is nothing but your disability limitation and rehabilitation. So, what is disability limitation? You are trying to limit the disability of a person. Like, what is a disability? Person will be affected due to polio, a person may be affected by the patient will not be able to walk properly. So, you are trying to minimize that by detecting the particular disease early and treating it, that is tertiary prevention. And then rehabilitation. Rehabilitation is you are trying to rehabilitate the person, like use of partial dentures, like fixed or removed partial dentures if a patient is having a complete edentulous mouth. So, that is the natural history of disease. So, natural history of disease usually follows a two phases, that is your pre-pathogenesis phase and your pathogenesis phase. So, here the pre-pathogenesis phase usually occurs when your epidemiological trial, that is your agent, host and environmental factors, which plays an important role in the occurrence of the particular disease. Then you have a pathogenesis phase, which causes the entry of disease agent into the human host. So, after the disease agent is entered into the human host, it is known as a pathogenesis phase. So, the final outcome of a disease may be either a recovery, a disability or death. So, a person can either recover, there will be some amount of disability which can occur due to the disease, or a person might die. So, these are the three final outcomes which can occur in a particular disease. So, this pathogenesis phase may be modified by means of intervention measures such as the immunization and your chemotherapy. Next concept is known as the risk factors. So, what are these risk factors? Risk factors are nothing but these are which help in, or these are risk factors are nothing but they are significantly associated with the development of a particular disease. So, which can be modified by thereby reducing the possibility of occurrence of disease or other specified outcome. So, risk groups, there are some risk groups which are there. So, risk factors like smoking causes lung cancer, excess amount of sugar causes dental caries. So, excess amount of sugar is a risk factor for the occurrence of dental caries. Smoking is a risk factor for lung cancer. So, these are known as risk factors. So, any amount of this will aid in the occurrence of a particular disease. Next, we will see what are the risk groups. Risk groups are nothing but increase in age causes, that is your age groups, which ages causes, increase in age causes a particular disease. The diet of the person, the family history, that is your hereditary factors which can involve in the occurrence of a particular disease. The race, aging of a particular person, the hormonal factors, the chemicals person is exposed, all these are known as risk factors or risk groups which are play an important role in the occurrence of a particular disease. Like I said, the smoking causes lung cancer. So, smoking is a risk factor for lung cancer. Lack of oral hygiene causes dental caries, increased amount of sugars causes dental caries. So, lack of oral hygiene and increased amount of sugar is a risk factor for the occurrence of dental caries. Lack of physical exercise is a risk factor for coronary heart disease. Those risk factors which can be modified are your smoking and hypertension. So, if you stop smoking, if you ask the patient to stop smoking, it can help in prevention of this coronary heart disease. And if you keep your blood pressure levels in control, then you can prevent the occurrence of hypertension, in turn lead to you can prevent the occurrence of coronary heart disease. Which those factors which cannot be modified are your age and genetic factors. Genetic and age factors are usually you cannot modify that particular factor. So, we have your target groups or the risk groups which have a direct relationship to the occurrence of a particular disease. The detection of the risk factors may be considered a prelude to the prevention or the particular intervention. Whether you want to prevent it or whether you want to do some intervention, it all depends upon the type of risk factor the patient is having. Next, we will see what is the spectrum of a disease. Spectrum of a disease is nothing but any subclinical infections, that is at the end of a disease spectrum, usually the subclinical infections which are not ordinarily identified, and at the other end you have the fatal illnesses, and in the middle of the spectrum you have the illness ranging in the severity from mild to severe. So, what you have at one end you have the subclinical infections, and then at the end you have the outcome, that is a final fatal disease that is occurring. In the middle you have the illnesses, that is based on the severity of the illness, you have from mild to severe. The sequence of events in a spectrum of a disease can be interrupted by means of early diagnosis and prompt treatment. That is, if you diagnose a particular disease early, then you can prevent the occurrence of disease, or by means of preventive measures with which if introduced at a particular point will prevent or retard the further development of a disease in a human being. So, according to this concept, the spectrum of a disease usually follows a particular phases, that is your subclinical infection, then your final outcome, in the middle you have your illnesses. So, in the illness, if you try to modify the risk factors, then you can prevent the progression of a disease. If you do some interventions, that is your mainly your primary prevention in the subclinical infections, then you can prevent the occurrence of a disease. The last concept is your iceberg of a disease. Now, we will see what is a new concept that is known as a iceberg phenomenon or iceberg concept, iceberg of a disease. So, according to this concept, disease in a community often represents a iceberg. So, what is an iceberg? It is a visible portion of the iceberg, represents the clinical cases which are usually seen by the physician. So, what are these clinical cases? So, clinical cases are nothing but the topmost which are there in the topmost portion of the iceberg. So, when you see this image, you have a topmost portion of the iceberg, which is the symptomatic cases or where the physician sees. Usually the disease, the person who are affected by the particular disease, person will come with any kind of sign or a particular symptom which we can diagnose a particular disease. So, that is your symptomatic disease or the tip of the iceberg, but you have the submerged portion of the iceberg that is not usually visible. They are usually known as a carrier of a particular disease. So, these subclinical infections, in this subclinical infections, the physician does not see this subclinical infections, because it is not, the signs and symptoms of a particular disease are not visible throughout. So, what you advise for the patient is, you advise for the maintenance of proper health and maintenance of a particular well-being. So, according to this, the submerged portion of the iceberg usually represents the hidden mask of a particular disease, that is inapparent, pre-symptomatic or undiagnosed cases or carriers in a community. So, what are these undiagnosed cases? Undiagnosed cases are nothing but any cases which are there in the community or in a particular area which are undiagnosed, which are not diagnosed properly. So, without patients will be as a carrier without showing the signs and symptoms of a particular disease. So, the waterline, usually the demarcation between the clinical and subclinical infections usually represents the waterline. So, that is where the apparent and inapparent disease occurs. So, in some diseases like your diabetes, hypertension, anemia, the unknown morbidity often exceeds the known morbidity. So, when you see the current chronic diseases like your cancer or your heart disease or coronary heart disease, in this mostly the symptomatic disease cases are usually the patients who are suffering from the diabetes. So, patients who are suffering from diabetes, they will be having some kind of increase in sugar levels, or there will be a loss of tooth structure. So, all these are predisposed to the occurrence of a particular disease, that is known as a symptomatic disease. This is where the physician sees the particular patient with signs and symptoms and diagnoses the particular cases, whereas the subclinical infections are always there in a particular community, where the people are more exposed to the particular risk factors. So, they are more prone to the risk factors, in turn they lead their life as a carrier of a particular disease. So, they will be there in the particular community as carriers, like your it is more common in your communicable diseases. So, what is a communicable disease? Any disease which spreads from person to person, like your COVID infections. So, usually it transmits from person to person without knowing whether the person is having a particular disease or not. There will be as a carrier who can transmit the disease from person to person. So, that is your pre-symptomatic disease which the physician does not see. So, this concept is known as the iceberg of disease. The last one is a changing concepts in public health. Under that we have 4 phases, that is your disease control phase, health promotion phase, social engineering phase, and health for all phase. So, what is disease control phase? Disease control phase is mainly the health problems that are faced by the community. So, what are the health problems that are faced by the community? It is usually the sewage, that is the environmental factors like sewage disposal, providing a proper water supply. So, all these are comes under the disease control phase, that is from 1880 to 1920. So, most of the healthcare infrastructure, mainly it was led to the disease control phase, that is how to control a particular disease, mainly the prevention of cholera. Usually cholera was more prone in this particular year. So, what happened is that they focused more on providing more good quality water supply, providing proper sanitation facilities for the community. So, these measures are not usually aimed at control of a specific disease, but improved health of the people due to the disease and the disease control. The next phase is known as a health promotion phase, that is from 1920 to 1960. So, the health promotion phase, usually in a health promotion phase, they want to promote the health of the people. So, how do you want to promote the health of the people? It is by means of providing proper health services to the people. So, maintaining a proper health services, that is accessible and affordable health care to the people. That is by means of proper establishing of primary health centers and sub centers, mainly in the rural and the urban areas. The main aspect of this is your active participation of the community members of all the people. There must actively participate in order to achieve a good health. That is your health promotion phase. So, in this concept they wanted to promote the health of the people by maintaining the proper health, by providing the proper health services to the people, like they are providing a primary health, like establishment of primary health centers and sub centers, mainly in the rural and the urban areas. So, main aspect of this is through community participation and active participation of the whole community. So, when the whole community they involve and actively participate, then the health of the people can be maintained. Next concept is a social engineering phase. So, they thought that there are other factors which are related to the occurrence of a disease. Apart from this environmental and agent and host factors, they thought that there are other social factors which can affect the particular person. With advances in preventive medicine and practice of public health, pattern of disease began to change. So, that is, they moved from the traditional approaches to social and engineering concept, that is social and behavioral aspects of disease were included in the prevention of the particular disease. So, what are this? That is your emotional well-being, physical well-being and your mental well-being of a particular person. All these were included. The last phase is known as the health for all phase, that is from 1981 to 2000. In this, they thought that the healthcare was not accessible and not affordable for all the people. So, they wanted to incorporate the health for all phase, that is your in a healthcare all phase, all the people must have equal access and affordability for the treatment. That is, the same healthcare facility should be available in both rural and urban areas. So, that is known as an accessible and affordable healthcare they wanted to achieve this by the year 2000. So, all efforts mainly are targeted towards the achievement of this goal, that is health for all goal. So, organized application of local, state, national and international resources mainly to achieve the health for all. So, because of this unequal distribution of this healthcare, all the people, mainly the people who are residing in the rural areas, they are not able to get the proper treatment, proper healthcare services that are not available for their needs. So, they wanted to bring the healthcare to their place, like establishment of primary health centers, sub centers in their community itself, so that they can utilize these healthcare services. So, that is changing concepts in public health. So, under the changing concepts in public health, you have 4 phases. The most important is your health for all phase. These are my references. So, till now we saw about what is concept of disease, what are the risk factors, what are the important epidemiological triad which are responsible for the occurrence of disease, what is the germ theory of disease, what are the causes, what are the spectrum of a disease, what is web of causation, what is spectrum of health. Then we saw about what is iceberg phenomenon, then about the changing concepts in public health. The important questions in this chapter are your multifactorial causation, web of causation, the risk factors of a disease, changing concepts in public health, germ theory of disease, pathogenesis and pre-pathogenesis phase of natural history of disease, iceberg phenomenon, spectrum of disease and your epidemiological triad. So, all these are important questions in this chapter. Thank you for patient listening.